Welcome back. You're watching DXB today. This is an episode where there's a lot of focus on health. And our next guest is Dr. Okan, who is a physical medicine and rehabilitation specialist at NMC Hospital. Dr. Okan, thank you so much for coming on the show.
Thank you very much. It's a pleasure for me.
Dr. Okan, especially with the younger generation, do you think we are informed enough about the importance of our bone health?
Actually, no, because our bone health starts from the young age, from our childhood. Because if we focus, create a good bone mass, it will be help about in future in our older age. Osteoporosis means weakened bones could cause easily breakable bones. So if we can create a good bone mass from the younger age, we can save ourselves from osteoporotic fracture in our older age. It's mostly related with good dietary habit at the early childhood, because regular exercise is very important about that. Good vitamin D and calcium intake is very important for the childhood. So especially for kids, it's very important to visit their pediatrician and check their levels of vitamin D and calcium. Making regular sports, weight-bearing sports is very important for keeping our muscles and bones much stronger.
Now, you mentioned that we need to start young, and obviously as parents, Ash and I are wondering, are there specific tests other than vitamin D and calcium that we need to have our kids take so that we know that we're raising them the right way when it comes to bone health and things like that?
Actually, kids not under too dangerous. Osteoporosis or other bone diseases generally start after older age. Of course, there's some problem with related bone disease with kids, but these are very rare disease. And of course, they have some symptoms like some change of shape of bones, for example, legs. And of course, if you are suspicious, there's a lot of tests like X-rays, bone density calculations, absorptiometry tests, a lot of tests we have. But we generally focus after menopause, because women are under very big danger with osteoporosis. Biggest risk factor for osteoporosis being a woman. Sorry for you.
That's good news.
Okay, but second factor is getting age, of course. So these two big factors we have to focus. Of course, there is a lot of risk factor different. For example, some lifestyle habits, sedentary life, smoking, excessive alcohol intake, or some specific medications like steroids, corticosteroids, or if you have some different illness like malignancy, cancers, you mean, and you are some thyroid metabolism disorders, all these things contribute to having osteoporosis and could affect bone quality and bone health.
You mentioned that it obviously affects women a lot more because of menopause, and certainly in my practice I'm seeing menopause kick in a lot earlier, and we're using therapies to handle that. Do you see any men, because that's also another trend that I've seen, where the neglected sex when it comes to osteoporosis?
Men generally affect in a little elder age, like after 70s. So World Health Organization generally recommends women to start screening them after 65, and men a little after 70s. Menopause is a big effect on bone health, because women living with estrogen hormone. After menopause, they are losing that hormone, and bones dependent for that. And suddenly they lose their sources and shouting each other, where is that estrogen? And they start being more vulnerable to impact. Even an osteoporotic person can break their bones, even walking here, and a small falling could cause hip fracture, and it's cause a huge impact in their lives. They will become dependent from now on, and the bone quality is not good, and recovery and healing is not that better like a younger age. So generally we want to prevent and protect that people before they have fracture. So detecting earlier this kind of patient is very important.
I mean, it's definitely good to prevent, it's good to detect, but obviously sometimes that doesn't work out. There needs to be some rehabilitation. What is the best approach to take when it comes to something like that?
Actually, as I say, I don't face the patient to need rehab, but of course it's our priority, primary job. If we face this kind of person, we have to rehabilitate them. We have to approach them in a holistic way, because it's not affect their only physical capacity. It's affected their family life. It's affect their job, because some of these people are working people, so maybe they have dependent to bed in a long time. They need a surgery. So rehabilitation, accessing early rehabilitation is very important. This kind of people, because how early we start their therapy rehabilitation, they will get up and start their life and go back their life, and independence life is much more early. So we focus in holistic approach. We are focusing, of course, physical therapy. We are trying to strengthen their muscles. We are trying to make their balance again, but we are trying to treat their anxiety, treat their depression about that, and we are giving education to these people to prevent further relapse periods.
Well, that's the thing. I mean, awareness is the most
important. Of course,
important
we
thing.
are trying to change their environment, make them more balanced, and some gait training, balance exercise. Sometimes we are recommending them yoga to get their much more balance, because it's very helpful about that. And we are changing their environment to prevent fallings, and that's it.
Well, thank you so much for letting us know all that. I've definitely got some stuff to think about. Dr. Okan, thank you so much for being on DXB.
It's a pleasure for me.
today.
Thank you very much. Nice to meet you all.
Thank you.
Now we are going to be exploring areas of dermatology. I know Louis, I know Ash have been waiting for this. I'm going to get some Botox over at Prime Medical Center. Now, when it comes to the medical field, of course, the main focus is on getting better after getting sick, but also when it comes to improving your quality of life, and sometimes it's all about looking good. And we are here at Prime Medical Center in Jumeirah to talk to one of the top dermatologists about everything to do with Botox. So let's find out what it's all about. And here we are with specialist dermatologist, Dr. Amina Jalil. Thank you so much for being on DXB today.
Thank you so much for having me.
Now, I hear a lot about Botox, and I'll admit I personally didn't know what it was. I thought it was like injecting plastic silicone into your face. I think some people might think that, but it's not that at all, is it? So can you tell us what is Botox?
Okay, Botox or botulinum toxin is basically, a purified protein derived from a bacteria called Clostridium botulinum. Okay, so it acts like a neuromodulator. So it prevents the release of certain neurotransmitters across the neuromuscular junction. So this, helps to relax the muscles, and it can also help, reduce the activity of sweat glands or oil secreting glands in your skin.
And is there any negative effect to the fact that certain aspects get numbed?
No, not really. So we, as a doctor, we are trained for it. We inject on specific points in the muscle so that it doesn't affect the other parts of the muscle in any way, and it doesn't affect the functions of your body or your face in any way.
It's very interesting. So tell us a little bit about how the process would go. Say I wanted to get some Botox. What would you check firsthand? Can everyone get Botox, or are there some people that should avoid it?
No, most patients can get it done. Only thing is you should avoid taking any analgesics or some supplements which can increase the risk of bruising or bleeding. Otherwise, and also it should be avoided in those who have certain neuromuscular disorders like myasthenia gravis. Otherwise, it is safe in all patients. But the main, thing we have to look at is the type of wrinkles the patient has. It is effective if the patient is having dynamic wrinkles. By dynamic wrinkles, we mean the wrinkles which come when you express or when you animate your face. Okay, so it is not a solution for those permanent lines which have already developed. So the results would last for around 3 to 4 months. Sometimes it can last up to 6 months depending on the activity and metabolic rate of the patient, but usually up to 4 months. So you will, I would say you will have to repeat it up to three times in a year, sometimes up to twice a year.
The things I do for this show. So the results are going to show up in about 3 to 7 days. and I'll catch up with you then. Thank you, Prime Medical Center, and thank you, Dr. Amina.
Look at you, Faris. I never thought this day would come when I see you get Botox on live TV.
I've lost the director's respect. He just told me in my ear.
Well, you have our respect, I'll tell you that. Right, Louis, it's time for the Daily Roundup. What do you have for us?
Well, check this out, Ash. The newly opened 01 Zabeel by Kerzner International offers a 360-degree approach to fitness and recovery with world-class specialists and digital technology. Their offerings include in-room refueling, yoga classes, anti-gravity chairs, and soundproof guest rooms with recovery equipment that are synced with guest circadian rhythms to ensure restorative sleep. Now, Dr. Nass, this sounds like something I'd probably see at DNA Health. Is this something that you would have in your hospital as well?
Yeah, and I think this is the trend in the right direction. I mean, we're outpatient, and so some of these technologies we won't have, but listen, whilst people are more into health and wellness, we're not particularly time rich. So the only time we get to spend to attend to our health is on vacation. And you're seeing this general trend in the hospitality industry where they are making efforts to try and go into the wellness provision whilst people are on vacation. But I think the important thing to point out is, you shouldn't just attend to it for 1 week of the year or 5 weeks of the year. It needs to be an ongoing process during your day-to-day life.
Dr. Azad mentioned a little bit earlier on at the top of the show, I've just had a mommy makeover and my healing process seems to be a little bit slower than what it should be for someone my age and my sort of fitness level. And my doctor highly recommended trying out the hyperbaric oxygen chamber treatment. Are you familiar with this one? And if yes, what is your take on it?
Yeah, indeed. I mean, this is one of these many wellness therapies that people are doing now and that you're seeing a lot more sort of popping up. Hyperbaric, yes, infrared therapy, which you'll also have come across. There are things called peptide therapies that can speed up recovery. Even just optimizing your nutrition and making sure your diet's right will also help.
Well, there are so many trends when it comes to healthcare and when it comes to longevity, and with that, I think there's some people that try and push stuff that isn't necessarily that good for you. Is there anything that we should look out for when we're getting all of these ads for how to live better lives where it might be doing the opposite?
So I think, as with any intervention, I mean, you're having a consultation with a healthcare provider. I mean, if they should be able to answer your questions and not dodge any bullets and provide you with the evidence. You're right. I mean, there's huge commercial industries behind a lot of these things, and I think you can sense it. I mean, we all can tell whether we're being sold a flop.
Well, Dr. Naz, thank you so much for sharing those. We're not done with you just yet, so please stick around. There's lots more coming up on the show. Faris, tell us what it is.
Yes, we're going to be taking a look back at all that was buzzing this weekend at the city's popular annual food festival, of course, Taste of Dubai.
Plus, we will get to meet a seasoned specialist in cosmetic surgery, so we'll know a little bit more about his expertise on facelifts, body contouring, and so much more. So stay right here on DXB Today.